All right, we'll go ahead and get started. My name is Tara Kalk. I'm the project coordinator for the Southeast Mental Health Technology Transfer Center on the School Mental Health Initiative. We are very excited to kick off our learning session on supporting mental health of students with intellectual and developmental disabilities and understanding and supporting the behavior of students with autism spectrum disorder, or ASD. If you have any audio or technical issues during the session, please use the chat box to communicate with our team, and we will do our best to assist you. If you'd like to share any of the resources, please do so in the chat box with other attendees. And you're also welcome to ask any questions to the presenters. We'll be monitoring the chat box throughout the session. And if you would like to turn your video on, we would love that. It's nice to see everyone's faces during these learning sessions. And then I'm going to read a quick disclaimer. So the Southeast Mental Health Technology Transfer Center Administrative Supplement is funded by the Substance Abuse and Mental Health Services Administration, and the opinions expressed herein are the views of the presenters and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsements of DHHS, SAMHSA, for the opinions described in this document is intended or should be inferred. And a little introduction to our center, if you're not familiar with us. Today's session is brought to you by the Southeast Mental Health Technology Transfer Center, or MHTTC for short, and more specifically, the School Mental Health Initiative. We are located in Atlanta, Georgia at the Emory University Rollins School of Public Health, and we're proud to serve the 8 states in HHS Region 4 that you see pictured here in orange. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems. This provides us a unique lens through which we can address mental health priorities in our region. And the goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. At the end of the webinar, there will be a link to an evaluation, and we'll put that in the chat box. It's really important that you take a few minutes to provide us with your thoughts, as it is required by our funders so that we can continue to provide learning sessions like this one at no cost to you. So thank you so much in advance for filling out that brief survey. And now I'm very happy to introduce Dr. Catherine Pickard and Dr. Diva Carey. Dr. Catherine Pickard received her doctorate in clinical psychology from Michigan State University and completed a 2-year postdoctoral fellowship at JFK Partners at the University of Colorado School of Medicine. Her primary research interest is in the translation of evidence-based treatments into community systems that are naturally positioned to serve children with autism spectrum disorders and developmental delays. Clinically, Dr. Pickard is a licensed psychologist and has a strong background in supporting individuals with ASD and other developmental disabilities across the lifespan. She holds specific expertise in parent-mediated intervention for young children, as well as cognitive behavioral therapy, or CBT, for youth with ASD and co-occurring anxiety. And Dr. Diva Carey runs the school consultation program at the Marcus Autism Center. She consults with schools across the state and provides training nationally. Her program emphasizes building capacity within school systems, and her research interests include increasing the efficacy of trainings for school-based professionals, increasing teacher self-efficacy through training support, and the application of behavior analytic principles and concepts in the school setting. And without further ado, I will hand it off to Dr. Pickard.
Thanks so much, Tara. And thank you all for being here this afternoon and taking time over your lunch hour. You know, it's a really busy time, especially in schools, and it's awesome to see such a large group attending today. I know Tara mentioned some housekeeping things, and I'll just hit on those again. Obviously, we ask that during the presentation that you keep yourself on mute, but please feel free to use the chat box to ask questions. make comments and share resources. We'll be monitoring the chat box during the presentation and potentially addressing some questions during the presentation itself. We'll also save time at the end for questions that come up. We ask if you're able to keep your video on. It's just nice to be able to see faces during a presentation and really kind of gauge how things are going. And then the last thing that Dr. Diva and I want to mention is that we will take questions. One of the things that we're not able to do is provide specific guidance on a specific child just because we have not met them. But we can answer lots of other questions. Briefly, the objectives for the webinar today are to describe and define common types of challenging behaviors among students with ASD, to explain the 3 primary reasons that we see challenging behavior occurring in these students, to discuss strategies for educators and providers to prevent challenging behavior in the classroom among students with ASD. And then at the end, we'll be talking about some additional resources that can, kind of continue the conversation and provide additional insight into this topic. And I'm sure Dr. Diva will mention this when she hops on to talk, but obviously we could chat for many hours about challenging behavior in our students with ASD. These are things that happen frequently, which I'll talk about in a little bit. And there are lots of different strategies aimed at supporting these students. And we're obviously limited by the fact that this is 1.5 hour, but really 1 hour talk. So the focus of today is gonna be on preventative strategies, knowing that there are many strategies to support these students. So let me give you a little roadmap here. So our agenda for today, I'm going to start off by talking about the prevalence of challenging behavior in our autistic students. Again, hitting on what some of those common, both challenging behaviors are and also common desirable behaviors or behaviors we want to see more of. We'll spend some time talking about how behaviors are learned. We'll talk about the function of a behavior, so why it is that a behavior might be happening, because if we can understand why something is happening, then it's much easier to support it. And then we'll be spending the back half of today talking about some strategies to prevent challenging behavior from happening. So without further ado, let's hop on in. And we have some polling questions to get started. And these are going to ask about your professional background, your relationship to students with autism, and your experience managing challenging behaviors. And so, Sarah, if you're able to launch those, that would be fantastic. So the first one, yep, is asking about your professional role. So we see a fair amount, looks like counselors, social workers, this makes sense, looks at mental health and behavioral background, administrators, as well as gen ed and special ed teachers as well. And a large other category. If you indicated other, could you drop in the chat box what your specific role is? Oh, I see. Mental health and wellness facilitator. Wonderful. All right. Sarah, I think we can go on to the next question. So we also are really curious to know how much of your professional time do you spend working with students with ASD? Love it. And I see people commenting in the chat box too. Thank you. Wonderful. So it looks like in this poll, so about 20% of folks are saying really not spending too much time, rarely or not at all. The vast majority of people say that they spend less than half of their time working with students with ASD. About 20% say half the time, and then about 10% of folks say either a majority of the time or all of their time. So really kind of varied varied time amounts there. I believe you have two more poll questions for this one. And then how would you rate your knowledge in supporting the behavior of students with ASD? And this is helpful for us to know as we begin the talk today, just understanding what background knowledge you're bringing to the table in this topic. Awesome. Sarah, do you be able to share that out? It looks like we have about majority of folks say they have limited knowledge in supporting the behavior of students with ASD, but also folks who have, more support in this area, and some folks who this is a new area. And so I'm hopeful that today will provide you with some tips and strategies that you can take with you. Great. And then last question before we get rolling. What are your most pressing questions related to challenging behaviors in your students with ASD? Great. Well, what folks are saying is are important questions to know. So the top three, those last three are what are rising. So what can I do to prevent the challenging behaviors from happening in the first place? So that's a lot of what we'll be talking about today, or at least starting to talk about. What can I do to help my student calm down or stop using challenging behaviors once they have started? And then lots of folks, kind of the largest group here, what are some of the resources that I can take back to my school that will help us support challenging behaviors? And so again, at the end of today, we'll be talking about what some of those additional resources or kind of follow-up options might be. And I see Tara just dropped the slides for today in the chat box. Feel free to download those and reference them throughout the conversation. Thank you for filling out those polling questions. It's really helpful to give us context, again, before we start talking about some of these strategies. All right, so let's get started. So I think it's important to mention before talking about challenging behavior that this webinar series is in some ways a sequel to a webinar series that happened this past fall out of the MHTTC, and that was focused on how to support the mental health of students with autism spectrum disorder. And it had a specific emphasis on students who have anxiety and challenges with emotion regulation. And during that talk, we also launched polling questions. And one of the polling questions at the end was, what else do you want to know more about? What did we miss here? What are pressing questions that you have? And the most pressing question that folks had was related to managing challenging behavior, right? These behaviors come up frequently and they often get in the way, especially in school settings. And so that's really the background for this talk. And I want to start off by giving just a quick overview of what we mean when we say autism spectrum disorder or autistic students, and then to give also a little bit of a background on mental health in this population. So when we say students with autism throughout this talk, we're talking about, again, autism spectrum disorder, which is a neurodevelopmental disorder that's characterized, oops, oh my goodness, the lights went off in this office, yikes. Sorry, team, didn't realize that this was one of those offices where the lights turn off automatically. Not an office I'm currently in, or normally in. So what we mean is, it's a neurodevelopmental disorder that's characterized by two specific challenges, one in the area of social communication and one in the area of kind of interests and behaviors, if you will. And so this slide just talks through what some symptoms might be in the students that you see with autism, although these are just some of them. So when we think about social communication challenges, we think about challenges with nonverbal communication. So eye contact is listed here, but this could also be challenges with gesture use and with understanding nonverbal communication as well. This includes challenges with what we call reciprocity, or kind of the ability to have kind of back and forth types of interactions. And so how this sometimes manifests is difficulties in having those kind of true back and forth conversations, for example. We see difficulty with peer relationships, and like I mentioned before, difficulty sometimes with perspective taking, or really being able to understand and read emotional and social situations.
One thing I want to also, sorry, Catherine, because I see this in schools a lot. Most of our students with autism also don't understand sarcasm. So when you are interacting with them, if you're talking to them about their problem behavior or why they're responding in a certain way or anything like that, sarcasm is not helpful for our students with autism. So that is one thing I wanted to.
Yeah, it's a really important point. We see it also come up just, when we think about kind of mental health too, really having a difficult time understanding the emotional experience of others and their own emotional experience. And then in the interest and behavior category, we're really thinking about special interests or restricted interests. So these are interests that are intense and kind of really can suck children in. So things like, for example, interest in Minecraft, or interest in having a restricted interest in, airplane schedules or specific things. Sensory differences, and I think this is important to know, especially when we think about things that may trigger challenging behavior. So some students may have be particularly sensitive to light, smell, touch, and especially loud sounds. We see black and white thinking, so just again, and then finally we do see some repetitive behavior, so things like hand flapping, rocking, and sometimes repetitive vocalizations. So why are we talking about behavior? Again, this stems from follow-up conversations that we had this fall around the mental health of students with ASD. So one of the things that we know about students who have ASD and just autistic individuals in general is that they are much more likely than folks without autism to experience mental health challenges. And so this slide just breaks down the prevalence rates of a variety of different kind of psychiatric conditions in individuals with autism as compared to the general population. And so you can see that, again, our students with autism are much more likely to experience ADHD, anxiety, depression, bipolar disorders, and schizophrenia. And so this is a vulnerable group of individuals. And in the webinar series this fall, we talked about why our students with autism are so vulnerable to these mental health challenges. But I think they're important to hit on. So let's then now chat about, okay, so how does behavior fit into the mental health picture? Is it the same? Is it different? What are we talking about here? So what I think is important to say is that challenges with emotion regulation, right, and anxiety can manifest as challenging behavior, including things like refusal and elopement, right? If you are nervous about something, you might want to avoid it, right? I'm personally scared of heights, and I try and stay off of high things. And so we may see challenging behaviors occur as a result of mental health challenges. It's also possible that students use challenging behaviors to regulate their emotions. And so you might see something like this where a student is becoming dysregulated and maybe they're rocking, right, as a way to kind of soothe themselves, or maybe they're stimming more because they're trying to regulate their emotional experience. However, I want to make it clear, and we're going to talk a lot about this today, that not all challenging behaviors are due to mental health challenges, right? And so our job is to understand why it is that a behavior is happening. And if it truly is, right, due to anxiety or emotion regulation challenges, we're going to support it. But we need to understand all of the possibilities and really dive into why it is that behavior is happening. All right. So What I want to hit on here is what exactly is the prevalence rate of challenging behavior in autism? And I think in doing so, it's important to note that challenging behavior is a broad term, right? And we're going to talk a little bit here in a second about what types of specific behaviors might constitute challenging behaviors. But for now, we're just going to talk about challenging behaviors broadly. How often do we see them in our students with autism? And so this slide here depicts a couple of recent studies that just looked at kind of prevalence of some different challenging behaviors. And what these showed is that about 68% of youth who have autism demonstrate challenging behaviors towards a caregiver. And so this is based off of caregiver report and caregivers of students or youth with autism. And about 42% of youth with ASD demonstrate some form of self-injurious behavior. So whether that be maybe hitting themselves or banging their head. And so as you can see, these prevalence rates are high, right? You know, this is almost, in some cases, a majority of students who are having some form of challenging behavior. And that's why this topic is so important. And not only is it highly prevalent, but it's also hugely interfering. I'm sure as you all can attest to, right? Challenging behavior really does get in the way of school participation, school performance, and other students and learning opportunities. So what do we mean when we say challenging behaviors? I think first I want to say there are lots of words. We also may say at some point problem behavior, undesirable behavior. All of those things are, again, broad, and our job is to be more specific here. So when we say challenging behavior, what might we mean? We might mean, for example, aggression. So that could be something like hitting or kicking or biting, tantrums, crying, screaming, dropping on the floor. And these are some other common behaviors. We see property destruction. Elopement is very common. And so that is running away or leaving an environment. Inappropriate vocalizations, task refusal, so saying no, yelling no, and like we talked about just now, self-injurious behavior. These are just some examples. There are more, and I would encourage you, especially those of you who are really kind of in the thick of working with students with autism, to share in the chat box other common behaviors that you see that may not be listed on this slide. So please do drop those in.
Yeah. One thing to also think about too, sorry, do you mind going to the previous slide, Catherine? Because I just want to address it, because I'm sure somebody in this group is thinking about it. There is a difference between tantrums and meltdowns. We recognize that there is a difference. The difference is typically not always observable though. So for the purpose of this training, we're specifically talking about observable behaviors, what we see. And sometimes that difference between tantrum and meltdowns, we really have to analyze the antecedents and what does it take to kind of get that student back to baseline. To me, the difference is a meltdown is that child is overwhelmed, and what they need is a quiet space to calm down, and they just need some time, right? Whereas a tantrum is, I'm mad because I'm not getting what I want, or I don't want to do what you're telling me to do. It's much more like functional in that way. Does that make sense?
Makes sense to me. But I want to also, the reason this slide is on here is because, I think as clinicians and educators and folks working with students who have autism, I think it is easy and natural to hone in on the challenging behavior, right? That's what we see, that's what gets in the way, that's what disrupts our classroom. But ultimately, right, at the end of the day, we're thinking about how can we support positive behavior, right? That's the end game. How can we support students and being able to participate and in using different ways of communicating or interacting or whatnot. And so we want to make sure we hit these things and also pay attention to them, because they're equally, if not more, I would argue more important. And so these things include sitting appropriately, right? Sometimes we take this for granted, but when are students at their desk, right? Asking nicely or asking appropriately for something that a student might want. playing or engaging in leisure tasks like recess or other activities appropriately, using words or sounds to communicate. Again, we might take that for granted or assume that it's going to happen, but those are important things to be paying attention to. Responding to their name, following directions, sharing toys. Because at the end of the day, we're going to try and increase, right, the presence or the likelihood of these types of behaviors happening. So we need to be paying attention to them and tracking them. Diva, is there anything you want to add before we move on to the ABCs of behavior?
I will add, because I've actually kind of made a shift with this recently. A lot of times when I go into classrooms and we're collecting data and, the focus often is on that challenging behavior. And that's what we're collecting data on. And it's almost like that's all we're really paying attention to. And I think if you had to choose one, and if I had to choose one, I would actually rather you collect data and focus on that appropriate behavior. Because if we're teaching an appropriate replacement behavior, if we're teaching a new skill, whatever it is, if we shift that focus, that problem behavior will naturally decrease, right? Because there's only so much time in the day. And if more time is allocated to appropriate behavior, that's less time that's available for inappropriate behavior. So I just really want to emphasize that appropriate behavior piece. And, if you have a behavior intervention plan, if you're, trying to work with a student, whatever the situation might be, just always remember you cannot treat a problem behavior without identifying a replacement behavior. So that replacement behavior is really important.
Mm-hmm. Yeah, thank you for hitting that. And so let's dive into it, right? So we talked about what types of behaviors we might be thinking about in our students. Let's talk about how we might go about understanding a challenging behavior and really trying to identify why it is that it's happening, because again, that's the foundation by which we start. All right, so what do we know about challenging behavior? Gosh, my computer, there we go. We know, right, and we've already started to hit on this, that both desirable and undesirable behaviors happen for a reason, right? Behavior is learned. It does not occur in a vacuum. It does not just show up. And so it is not random, like that slide says. We also know that the same behavior doesn't happen for the same reason, right? I think about a child who hits a peer, right? Well, why might they hit that peer? They could have hit that peer because they were upset and they were protesting with that peer, or they maybe, if they're a child who does not have communication or struggles to use communication, they might have hit the peer to initiate, right? To start an interaction. And so I think what we want to be really mindful of is how can we understand a behavior, right? How can we understand why it's happening? Because it's not all the same. And again, if we know why a challenging behavior is happening, then we can figure out what to do to prevent the behavior or support the behavior. So the model that we're going to be talking about today is a very common one, and it may be one that you've heard of, especially if you're working often on the behavior in these students. We're going to be talking about the ABCs of behavior. And so really what this is referring to, that when behavior happens, typically there is something in the environment that changes before a behavior happens. And then after the behavior happens, there's also kind of a change in the environment or something that happens. And so what we're talking about here is an antecedent. So the antecedent is what happened before the behavior. So for example, maybe the behavior is that a student kind of throws their papers off the desk, right? So we'd be thinking about, well, what happened right before that? And it could have been that the teacher called on the student, right? So we want to be paying attention to what happened. Then we also think about what happened after the behavior. And that's what we call the consequence. And so when the student threw their papers off the table, the teacher said, let's take a break. Let's go to the cozy corner, right? And all of a sudden that is a change in the environment, right? And that's the consequence for that behavior. So when we talk about the ABCs of behavior, we're talking about the antecedent, the behavior, and the consequence. That is where that acronym comes for. And it really just means we're paying attention to what happened before and what happened after the behavior. And we're going to talk about each of these things in a little bit more detail. Okay, so the ABCs of behavior, this just talks a little bit more about kind of what it is and why you do it. But again, when you can identify changes that occur, like Diva said in the chat box, immediately before the behavior, what you can then do is make adjustments to then support the behavior. So if you know, for example, that I don't know, the task that you're asking the child to do is particularly challenging, and every time you call on the student or you kind of ask them to do something, they throw the papers off the desk. We can think about, okay, well, how do we change what's happening before the behavior to really support the student? And the ABCs, we think about them applying to learning or kind of skill acquisition. Like Diva mentioned earlier, we're also thinking about replacement behaviors. We're never thinking about decreasing challenging behavior without thinking about what we want to happen instead. It also applies to communication behaviors and understanding challenging behaviors. All right, so let's chat about antecedents. So what are they exactly? Like Diva mentioned, these are the things that happen in the environment immediately before a behavior happens. And so in these situations, we want to be thinking about a few questions that are depicted on this slide. So first, who is involved? Was a teacher there? Was a peer there? Was it a caregiver who was present? What occurred? So what exactly occurred? Was the child told to pick up the toys? Did they hear a loud noise? Did their favorite person leave the classroom, right? Were they told that there's going to be a change in their schedule? So really we want to think about who's there and what exactly happened or what exactly changed. And then obviously, where did the behavior take place? Was this in the classroom? Was it in the hallway? Was it in the cafeteria? And so we're taking careful data on exactly what happened before the behavior occurred.
One thing I also want to address here too, because again, I hear this in schools all the time. He didn't have a good night's sleep, or they got in a fight with mom on the way to school, or they didn't get their favorite breakfast. It wasn't the right flavor Pop-Tart. And so those are actually what we call setting events. So it's just like this specific type of antecedent that happens like way before. And you can kind of think of it like it happens to all of us, right? Like sometimes we have a great morning and everything goes well and we're in a good mood. And, if somebody cuts us off in traffic on our way to work, we might just be like, whatever, like not really care. Whereas if we didn't have a good night's sleep and our favorite flavor Pop-Tart wasn't there, our kid ate the rest of it, or, if whatever happens that morning that like kind of makes you a little cranky, and then you're driving to work and somebody cuts you off, you might be a little bit more inclined to, honk your horn or, like shout something, like, oh, stupid person, whatever, like you're going to be more cranky. So those are, of course, like we're all human, right? Like our students are going to experience those things as well. But it's really like, so in those examples, all of those other things that affected my mood are setting events, but it was actually the person cutting me off that was the antecedent. That was the trigger for the behavior. Does that make sense to you guys? Okay.
Thank you. And the behavior itself, we're going to be talking a little bit about this in more detail, but the behavior, right? I think one of the things that at least, I've seen happen is, when you ask a parent, right, or you ask a teacher, you ask someone what the behavior is, it's often kind of amorphous, or, it's hard to really nail down like what exactly is happening. And so when we're thinking about challenging behaviors, we're thinking about, let's get as concrete as possible. And these are some specific things to be thinking about when you're tracking behavior. We want it to be observable, right? So obviously, if you didn't see it or hear it, it's not possible, right, to describe it. These are not hypothetical things. We're here talking about the real thing. So we want to be able to hear it and see it and record it. This helps when thinking about what it looks like to operationally define it, right? So when we think about operationally defining an event, the slide says describe an observable event. So what might you describe, right? You might describe, for example, obviously what exactly happened. Did the student hit? Did they kick? Did they yell? How long did it last? What was the intensity? What happened? And so we're thinking about, we want to get as concrete as possible, ultimately, so that, if you were to be able to describe the behavior to a stranger, they would be able to tell you if the behavior occurred, right? And so we want to be extremely concrete. And then thinking about consequences. We've already started to talk about these things, but they are what happens immediately following the behavior. So it's that environmental change after the target behavior. And ultimately, right, this environmental change either helps to kind of reinforce or kind of keep a behavior going, or ultimately help a behavior kind of lessen, if you will. It's important to know that some consequences are good, right? And consequences happen after all behaviors, including those that you want to increase, right? So, I go to work, and what happens when I go to work? I get paid, right? I greet and I smile at someone, and oftentimes they smile back at me, right? And so we think about this for all behavior, not just challenging behaviors. And again, we're paying attention to what happens after the behavior, because knowing what that consequence is allows you to change the consequence. So for example, if a student swipes his papers off the desk and ultimately they go to the cozy corner, right? That's that consequence or that change in the environment. And really the student swiped the papers off the desk because the task was hard or they didn't want to do it. Then going to the cozy corner, we think about, well, what's going to happen next time, right? That consequence is likely going to increase the chance that the behavior happens again. So it's not just enough to know what the consequence is. You also need to know what and why kind of the behavior happened in the first place. This slide here, we have a couple slides that talk through common consequences. And so this table breaks down things that we're thinking about. So you'll see on the far column, we have kind of the labels for positive and negative, and then reinforcement and punishment across the top. Positive meaning, again, we're adding something, negative, removing something. Reinforcing means that we were going to increase or maintain the behavior, and punishing that we're ultimately going to decrease the behavior. On the next slide, we're going to give kind of concrete examples of what these terms mean. These are terms that we often hear in reference to behavior, and I think they're really important things to understand to know that you're using kind of these terms correctly. So if you're doing positive reinforcement, you're adding something that increases or maintains the behavior. So you might give a sticker, you might give a token or a reward that's going to increase the behavior. We also see negative reinforcement. So that's removing something that increases the behavior. Positive punishment is adding something that decreases the behavior. And then negative punishment is removing something that decreases the behavior. And I'm going to give some examples on the next slide. So what might this look like in a classroom or a school setting? We've already talked about positive reinforcement. I think when I think about different consequences, I feel like this is one of the ones that's most often talked about. And this is earning a sticker, earning a break, praise. So again, we're adding something that increases the behavior. Positive punishment, I think about being spanked or yelled at, right? We're adding something negative. And then negative reinforcement, we're thinking about, students who are getting out of a chore or something difficult because of a specific behavior. So that student who swiped his papers off the desk and ultimately he gets out of doing the task. So he's more likely, right? We're reinforcing that behavior because he's getting out of doing something. And then negative punishment is maybe potentially losing recess, losing time spent in a preferred activity because of a specific behavior. Again, losing something and thinking that the behavior might decrease.
I'm going to chime in again.
Yeah.
So I really do want to emphasize here that like these examples and the category that they're placed in, that is our intention, right? Like we intend that when we provide praise for a specific behavior, that behavior is going to increase, that response, that consequence that I deliver is going to increase that behavior, right? But I do not know if it actually serves as a reinforcer until I see a change in the behavior. If you are not seeing a change in the behavior, then you are not delivering a consequence that is really having any effect on the behavior, right? Like sometimes it's a neutral consequence. Sometimes, you think you're delivering a reinforcer, but you're not seeing the behavior change. Well, maybe it's not worth it to them, right? Like we all work jobs, we all earn a paycheck, and probably before you accepted that job, you had a conversation about what your pay was going to be. And I'm sure we've all been offered a job and we were like, no, that pay is not worth it. It's not worth what you're asking me to do. Same thing for our students, right? If we're not offering them a reinforcer that is strong enough, we're not going to see change in their behavior, right? And then on the other side of things, if we're talking about punishment, there's a couple things I want you to remember with punishment, right? Number one, punishment, if a consequence is actually punishing and effective, then you are going to see an immediate change in the behavior, right? It's going to be immediate. If you are not seeing a change in the behavior, then you might actually be reinforcing a behavior thinking that you're punishing it, right? So if we see the behavior increase, you're reinforcing the behavior. You didn't mean to, but you are, right? The other thing to think about is if you're not seeing a change in the behavior at all, then what you could be doing is implementing this aversive consequence, pairing yourself with aversive consequences, and then not even having a change on the behavior, right? And I understand we live in a very punitive society, a lot of discipline systems within the school setting, they're punitive, right? But it's really not the best way to shape behavior. It's not the best way to go. Our research tells us time and time again that behaviors that are shaped through reinforcement are going to be much stronger. You're going to have longer lasting impacts on that behavior. Does all of that, did I explain that okay? Does that resonate with you guys?
I thought so. And I saw a chat box. It was addressed in the chat box. It was just a question about, I think that it can be confusing, like the positive and negative. When we say positive punishment, right, that feels like a contradiction, right? And so we're really talking about adding or adding something kind of with the intent of reducing behavior. Doesn't mean that it's good, right?
Yeah, it's just a difference of like the positive and negative is you're either adding something or you're taking something away. That's all that means. I think the most important thing to remember is that difference between reinforcement and punishment, and always remembering that it's actually, you cannot determine whether it's reinforcement, punishment, or even a neutral consequence until you see whether or not it changes behavior.
Mm-hmm. I agree.
Yeah.
So let's give it a try. So we have just a couple of quick little practice examples here. And so what we'll do is have you in the chat box, drop in what you feel like might have been the antecedent and the consequence within this specific scenario. So this one here is Miss Ortega teaches in a kindergarten classroom. She is issuing demands to Michael during direct instruction. So she's given demands to him when Michael swipes materials off his desk. Miss Ortega responds by prompting Michael or telling him to pick the materials up that he swiped. He does not immediately comply, and Miss Ortega then models what Michael needs to do to help him comply. Michael eventually picks up the materials, and Miss Ortega resumes instruction. So use the chat box and drop in what y'all feel like might have been the antecedent. So what was that immediate kind of environmental change that triggered this behavior, and what the consequence was of that behavior? All right. Oh, lots of responses here. Let's see. So we see demands, antecedent demands, consequences, swiping stuff off the desk, issuing demands, consequence getting help, consequence. All right. Fantastic. Yeah. So in this situation, again, we're thinking about what was the immediate kind of situation that happened before the behavior. The teacher issued the demand, right? What happened immediately after the behavior? Great. Attention to interaction. Yeah. Great. So let's do one more here. So this one here says, Mr. Smith teaches in a self-contained classroom, and Joseph is one of 6 students in the class, and he has free access to the iPad throughout the day, except for during learning time. Mr. Smith tells Joseph that it is time for some learning and asks for the iPad. Joseph screams no and runs to the calming corner. Mr. Smith leaves him alone because they have taught Joseph to go to the calming corner as a replacement behavior for aggression and destruction. So again, what was the antecedent here? And what was the consequence, or what happened after the behavior? Yep, great. So asking for the iPad during learning time. Yep, essentially kind of taking the iPad and looking for consequences. Yep, and consequence going to cozy corner, calming corner. I see those. Fantastic. And so again, why are we thinking this is helpful? Because ultimately we're trying to understand at the end of the day, how can we first prevent the behavior? So what are the situations or the triggers for a behavior that we can manipulate? So that way the behavior is less likely to happen. We're going to be talking about those in a little bit. And ultimately, how can we change the consequences? How can we manipulate what happens after a behavior so that it is less likely to happen? So we really want to be cognizant of carefully taking data on what happens before and after behaviors occur. All right.
All right. So next we're going to talk about how behaviors are learned. So we are going to talk a bit about the functions of behavior, because I do want you guys to know that they exist, right? That there are these different functions of behavior. But I do want to kind of add the caveat that like we're not necessarily going to talk about all the ways that you can identify function. That would be, I mean, I do a 2-day training on that. So it's a lot. But I do want to talk about the different functions of behavior. And really, like when we're talking about the function of behavior, it's just, why is the behavior happening? What is the child saying with this behavior? What are they trying to access? What are they getting through this behavior? And knowing the function of behavior is really important. So let's kind of walk through this example. So first, Mr. Smith asks John to stop using the iPad, right? Kind of similar to that last example. In response, John tantrums. And then Mr. Smith sends him to that calming corner. So John gets to spend time in a calming space. But he's not getting to play on his iPad in the calming space. All right. So in that situation, John is less likely to tantrum next time, right? But do we see the difference in this example as compared to the other one that we just talked about? So notice the antecedent in this one is just, hey, iPad time is done, right? And in the previous example is iPad time is done and it's time to go do work. All right. So let's kind of go to the next example to kind of bring things full circle on that. So in this next example, Mr. Smith asked John to write his name. John tantrums, same behavior, right? Same consequence. He gets sent to the calming corner and to chill out. But in this example, he gets to avoid the work. He avoids writing in that calming space. So in this situation, he's going to be more likely to tantrum. All right. And, you know, these two examples are like all tied up with a bow, clean and pretty, you know, one antecedent, one consequence. That is not real life, right? We all know that. If y'all are in a classroom, if you're working with students, if you have children of your own, you guys probably already know that it's not always that tied up and clean, right? We often have multiple consequences, multiple antecedents, and it can be difficult to piece out like what is the most important antecedent and consequence. So, you know, at the end of the day, we have to look at all of them. What is happening and how do we ensure that we're not accidentally reinforcing problem behavior, okay? So our most common functions, not most common, these are the functions of problem behavior, these four, right? They're all gonna fit into one of these. So first is we have our social positive. That is access to someone or something, right? Attention and tangible. They're getting access to something. And then we have our social negative. So that's escape from someone or something, right? In schools, we're most commonly thinking about academic tasks, but it goes beyond that, right? It might be a specific peer, it might be the cafeteria, things like that. And then the third category there is access or escape from something internal, right? That's what we assume. That's basically what we call our automatic function. It's all we know is those social pieces are not impacting the behavior. It's not a social function and therefore it's automatic. So I see the question in the chat box about power as a function or control. I'm assuming you're probably, you know, using power interchangeably with control. I personally, so I have been working with kids with challenging behavior for 12 years now. And I have never worked with a kid where like it's just control. That's all they want. Typically, from everything that I've seen in my experience, it is control of something. It is control of your attention. It is control of the activity. It is control of access to preferred items. It is control of how I'm going to do my work, where I'm going to do my work, and those sorts of things. So at the end of the day, it still fits into one of these categories. Does that make sense? I hope so. All right, cool. So let's kind of go through these just slightly more depth here. So remember with escape, the escape function, behaviors that a student engages in to escape or avoid something or someone. School, we're typically thinking about tasks or demands, but we also have people. So every now and then we'll see some social avoidance. So sometimes it's just a particular person. Sometimes it's, I just completely want to be left alone. So you see some variability in that. I oftentimes see students engaging in problem behavior to escape specific environments. Commonly the cafeteria, right? If we think about the cafeteria, there's so much noise, everyone's talking. Sometimes we have microwaves beeping and humming. We have the fluorescent lights, we have all the different smells. There is just so much going on in a cafeteria, and that can be really challenging for some of our students. So that's a common environment that they might want to escape. Sometimes the gym, and there can always be, specific environments that we find that they're trying to escape. And they, you can gain escape appropriately, right? Like, I'm an introvert myself, and there is always a point where I'm like, I'm done being social and I'm going home, right? And I say bye and I go home. So I'm able to engage in those behaviors appropriately and say like, all right, guys, I'm leaving the party, right? Some of our kids with autism don't have that ability, or they don't even have the ability to recognize that they're becoming overwhelmed, right? They might engage in problem behaviors, gain escape. So some desirable behaviors, things that we can teach them, right? Asking for help. If I am going to go towards like functional communication training, if you guys have heard of that, in schools, I see it all, schools and clinics, I see it all the time. We're going straight to teaching them to ask for a break. But asking for help is a much more functional skill, right? Think about all the time. Like, I still to this day will ask people for help. If there's something, I did it this morning, right? And I'm trying to figure something out, didn't know how to do it. I went to a colleague and was like, how do I do this, right? And we actually put some time and figured it out. So asking for help is a very functional skill. And sometimes we have to teach our students to ask for help and reinforce that behavior too. Because a lot of times, especially if you're working with students who are, quote, higher functioning or typically developing EBD, that sort of thing, oftentimes I see they'll ask for help, and then the response from the adults in the environment is, you can do that. You need to try a little harder. I need you to try on that a little bit more. You have that, right? And then they don't get help. So then they stop asking for help, and then they learn that problem behavior gets what they want. So watch out for that. The next function is, I can just go on to the next one. The next function is tangible or access. So a lot of people just call this access, and I don't like that, because really all the functions are access. Access to a break, access to attention, access to preferred items, right? It's all about access. But this one specifically is access to preferred items or activities. The technical term is tangible. And so if you want to remember, tangible is something you can touch. That's how I remembered it. But these are behaviors that a student engages in to gain access to something, a preferred item, preferred edible, preferred activity, preferred space, all of those things. And again, just like every behavior, there's desirable ways to get what you want, and then undesirable ways. You can ask for it, you can point to it, leading by hand, asking for more time, all of those things, asking to work with the person that you want, and that kind of mixes up, actually all 3 social functions, but I don't need to get into that. Undesirable, screaming, dropping to the floor, licking items. That behavior just always makes me chuckle. That one, and growling. Kicking, refusing to comply when working with a non-preferred person, things like that. And then our next one is attention. So again, this is any behavior that a student engages in to gain access to someone. So praise, reprimands, physical, vocal. Remember, attention is attention. For some of our students, it does not matter the type of attention they access as long as they're getting attention. Probably one of my pet peeves is when caregivers say, he's just doing that for attention. Okay, so you know why he's doing it. Like, that means that he or she needs more attention, and that the level of attention you are providing is not enough. So there's, always ways to treat that. And just like everything else, there are desirable ways to gain attention and undesirable ways to gain attention. Raising your hand, saying someone's name, tapping someone on the shoulder, etc. And then we have those undesirable behaviors: hitting, screaming, knocking things over, mooning kids on the playground, crawling under the lunch table. I feel like I've seen it all, and then like I find a new one. I'm just like, man, there's something new to add to my list. So yeah, so all of those are our social functions, right? And we call them social functions because there's something else in the environment. There's someone else. There is another person in the environment who's controlling access to those things, right? And then we have automatic reinforcement. Automatic reinforcement just means there is something about the behavior in and of itself that is reinforcing, right? So that also means that every time the student engages in that behavior, the behavior is reinforced, which means every time the behavior is reinforced, the behavior is strengthened. Okay, so automatic reinforcement is the most challenging behavior to treat. Okay, so some examples: hand flapping, because the movement feels good. And that's an assumption, right? We assume that the movement feels good. But unless a student can actually tell me that, I don't know, right? So because we sometimes call it sensory as well. Y'all familiar with that? Just remember that that sensory piece is an assumption. We assume that based on our own personal experiences. And if a student cannot tell me that it's sensory, then it's just an assumption. Okay. And then it's always hard to figure out, like, you know, if they can't tell me and it is sensory, like, what is it about it? Like, can I figure out how to match it? Something like that. So let's get back to some practice, right? So these are the same examples as before. Miss Ortega is teaching kindergarten, Michael's swiping his materials off the desk and requiring all kinds of prompting to get the things picked up. So we already identified the antecedent and consequence here. What do y'all think are the potential functions of this behavior? Jones, okay, so that's a good question. I'm gonna address it before I get onto this. So the question was asked, what is the line between which sensory soothing motions are considered acceptable and which are considered challenging? I think people, like, everybody's gonna have, not everybody, but a lot of people are gonna have different opinions on this. For me, I think we need to celebrate neurodiversity, autism acceptance, all of those things. So I think it's important to allow students to do things that they enjoy, right? We all have our own automatically maintained behaviors as well. I have a terrible issue with picking at my cuticles, right? So like that is an automatically maintained behavior that I need to work on, right? But because it's automatically maintained, it's really hard to treat, especially when you're self-treating. But where it becomes a challenging behavior is when the student is hurting themselves or others. So we're talking about like physical damage, right? Or when it's interfering with their ability to engage in the social environment, right? So that, to me, that's when it can be, that's when I will treat it. But besides that, like, I'm gonna let them go. And it's really, to me, it's more about teaching them when it's okay and when it's not okay. So I hope that answers your question. Okay, so I'm going back to the comments based on this example here. I'm seeing potential function avoidance, task avoidance, maybe attention from the teacher because the work may be too difficult and he wants individualized help. George, I'm going to pick on you a little bit because you fell into a trap that people always fall into, right? We always want to assume. We want to assume why. We want to assume that the work was too difficult, wants individualized help. Those are assumptions, and we actually got to go back to the data. We got to see multiple examples, maybe talk to the student, things like that. Those assumptions are highly likely, right? But we do have to remember that those are assumptions. I still do it myself sometimes. it's a natural inclination to kind of jump to that next step, but we do always have to remember that we got to go back to the data. So good examples in here. And I like that you guys identified that there could be more than one function here, right? The antecedent is they're already getting on one-to-one attention, but it's demands, right? And then materials are swiped, and we have prompting. We have a delay of the demand. Maybe picking up items is easier than what you're asking them to do, right? And so we gotta see multiple examples, maybe make some changes and see how that changes behavior too. So again, how do you know? More data, right? We gotta see multiple examples, maybe change how Ms. Ortega responds, and see how that impacts behavior, that sort of thing. Next up, so is Mr. Smith and Joseph. Joseph run into that calming corner and he gets to be left alone there. So what do you guys think are the potential functions for this behavior? So attention, tangible, escape. Oh, we got one. There we go. Escape, attention. Okay. Not wanting to stop iPad. Access to a space he likes and avoiding work. Yeah. All right. So we are great responses here. So potential functions, if I'm looking at the consequences of this behavior, the consequences are both escape from demands and access to the iPad, continued access to the iPad. So those are the two potential functions that I would be looking at. I would not be looking at attention because the consequences that Mr. Smith actually leaves them alone, right? So I wouldn't be thinking attention with this. If anything, it might be social avoidance too. Like maybe he just doesn't want to talk to Mr. Smith, right? And again, we got to go back to the data and we got to see how does this response impact behavior, right? Do we see that every time that Mr. Smith says, all right, Joseph, it's time to do some learning, he runs to the corner with his iPad? Guess what? That's what he wants, right? So we're reinforcing the behavior with that response. So something needs to change. Okay. All right. So now we're going to get into antecedent strategies. So I do want to emphasize, so antecedent strategies are just anything that you do before problem behavior occurs to prevent the likelihood of problem behavior. So when we're talking about antecedent strategies alone, just think of it as preventing the problem behavior. And I do want, like, this is what we have time for today, but I do want you to remember that antecedent interventions alone are not always going to be enough, okay? So first general strategy to remember is teaching new skills. Sometimes students are engaging in problem behavior because they don't know how to access that reinforcer, and this is what they know. I think of a particular student that I worked with. He was, you know, he had back and forth communication. Like he was so like high, and I keep putting it in quotes because I don't like using the term, but he was like so high functioning that like it was easy for people to forget that this kid had autism, but he does, right? And so that social awareness and social interaction skills were really missing. So he was engaging in problem behaviors. And even, so in this particular case, I was working with the mom, and even the mom was like, he's so annoying, complaining about how annoying he is. And I was like, he's going to continue to be annoying until we teach him appropriate social interactions. Like, he is using that behavior because that's the only way he knows right now to get your attention, right? So we got to improve our social interactions, and then those behaviors will naturally. So here we have some examples of antecedent strategies that we could talk about. We are only going to talk about priming today, so ways that we can change up the environment to help our students understand the environment. But we have some others there that can be helpful. It's just more than the scope of today's talk. So when we're talking about priming, we're talking about classroom setup. How do we set clear expectations and the use of visual schedules? And I have some examples for you on the next slide. So number one, we want to establish clear boundaries between areas of the classroom. Oftentimes we're doing this with tape, colored tape that's either on the floor, on the desk, or other visual supports. Catherine, will you click those pictures? So this helps students access instructional materials. Teachers can see things. So those are all things that you want to think of. But remember that just because you put these visual supports in, it's not magic. It's not going, just having the visual supports there are not going to be enough. You have to teach the student what all of those things mean. And then we have photos for you on the next slide. So here's an example of some visual supports that I commonly see and recommend in classrooms. So that first picture, just having that tape on the floor. We sometimes have students who have a hard time sitting still and sitting in their desk all day. And I have problems sitting at my desk all day. So can we give them a boundary to say, like, hey, you can stand, but you need to stay in this space, things like that. The next slide, we have use of classroom organization. If we're working with students who need a lot of one-to-one instruction, these 3-drawer bins can be great. Up above there, you see the visual schedules. Those are just color-coded visual schedules for each individual student. Each individual student also has a reinforcer menu below their schedule. So that is a way for them to choose their paycheck, right? They're picking their paycheck. What do they want to work for that, subsequent learning interval? And then here's some examples of what individual student schedules can look like. So for our very early learners, oftentimes we're just using color coding. And then once they're understanding the color coding, maybe we add pictures. Sometimes we're adding pictures of the actual environment. Sometimes we're adding graphics. It just depends on your particular student. Then once they're starting to read, then we can add some text to it as well. And then we have this schedule here. It's actually, it's all in a manila folder and it's all laminated there. And the student moves that activity or that card over as it's completed. I do want to emphasize here that the student needs to understand that we have, like, this is our column of what still needs to be done, and this is our column of what is already complete. Some of our early learners aren't going to understand that. They need that kind of like object permanence. They need it to be gone for them to understand that it's over. I also really like using those manila folders. So in one of my classrooms recently, I set it up to where like everything's in that manila folder. So you have your schedule on the inside. On the front, we have a first then schedule or a token board. And then we have that reinforcer menu on the back. So all of those students' visual supports are in one manila folder. And it's just a nice way to really keep everything together. Because I think that's probably the hardest part of visual supports is remembering to use them and remembering where they are and keeping track of them. Another thing I want to emphasize, sorry, Catherine, can you go back to the previous slide? I do want to emphasize that if you are using a visual schedule like this, and you're working with early learners, I strongly recommend having like your laminated schedule template and then having those individual cards that are movable, because if you have it all on one thing and you laminate that whole thing and then your schedule changes, or there's a change in your day, you got to make a whole new thing, right? Whereas if you have all those separate cards and you need to make a change in the student's day, you just move the cards, right? And you don't have to make new materials. I just wanted to point that out. And then here are some examples of other visual support. So if you have students who maybe are visually impaired and need that texture, so maybe they haven't learned Braille yet. You know, if we're working with students with disabilities and they're blind, there's a good chance they haven't learned Braille. So we can use other items that they can touch to help them understand their schedule. So just quick summary, antecedent strategies, just remember it's something that we change in the environment before problem behavior occurs, okay? So if we wait for problem behavior to occur and then we make a change to the environment, we might accidentally be reinforcing that behavior, right? That's the difference between reinforcement and bribery as well, right? If you wait for a child to engage in problem behavior and then you're like, oh, but if you do this, then, you know, I'll give you this candy or whatever. That's bribery. That's not reinforcement. You got to set it up ahead of time. Next. So with antecedents, you want to remember to create structure and routine that is understandable to the student, right? I really want to emphasize that. I went into some classrooms yesterday and I was looking at visual supports, and this teacher had a whole visual schedule put up and they use like actual pictures and everything. And I'm looking at it as a full-grown adult and I'm pretty well educated. I have a PhD. I would say I'm pretty smart. I could not figure out what that schedule meant, right? So sometimes you might want to have somebody else come in and say, hey, do you understand this? Does this make sense to you? And don't give them any clues and see if they can figure it out. And if they can't figure it out, you better believe your student's not going to figure it out, right? So you got to make sure that you are setting up those visual supports in a way that is understandable to your students, and always going back to them, referencing them, using them. It's not enough to just have them there. You got to actually use them. And remember, it's not going to prevent all challenging behaviors. So that's why we also want to be thinking about the function. You don't always have to wait for an SPA and develop BIP and all of that stuff. If you have a basic understanding of function, you can, in that moment, think, okay, what is this kid trying to get right now? Are they trying to get out of something? They're trying to get candy or, you know, whatever. Like, think about it and make sure that they don't get what they want through problem behavior. Maybe you can teach them an appropriate way to get it and reinforce that, but make sure that you're not accidentally reinforcing problem behavior.
All right, just to wrap up, I see that Sarah put in a little reminder in the chat box. We do ask that we have a survey that kind of wraps up this presentation. It's a great way to give feedback and for us to understand how we're doing. And it's also really important for SAMHSA and the funding for this presentation. We do have a few quick polling questions to wrap up today. And this is really to help us understand what information might be useful moving forward. So let's do these couple of polling questions, and then we're going to end with some follow-up resources. So if you continue to have questions or want to bring things back to your school team, we'll hit on a few things. Sarah, could you launch those polling questions? Awesome. So the first one is for students with ASD, I would like more information on, and you can obviously choose more than one. This is fantastically helpful. Thank you for filling this out. We see lots of things, but it looks like the most common response right now is how to help students regulate their emotions and how to teach a more appropriate behavior. Also how to prevent a challenging behavior and how to increase positive behavior in students. So we'll be saving these and really thinking about how we can dive into some of these topics, knowing that a 1-hour presentation, we can just, as Diva mentioned, we can only scratch the surface and really thinking through behavior, but there's lots of potential follow-up. Whoops. Sorry, I'm going to go back for a sec. I believe there's one more polling question, if I'm remembering correctly. Yep. For the topics that I've identified in the previous question, what would you want more information on? So if we were to give more information on how to teach a functional or more appropriate behavior, what do you want to know about? All right, I see folks saying informal strategies, formal school treatment options, and training and continuing education, as well as how would you finance a program like this or sustain it in schools, just is really important to be thinking about. I want to make sure we hit on these additional resources while folks are still on. Again, if you have time, please fill out that survey that Sarah had dropped in the chat box. But Diva, I'm going to hand it off to you for the additional resources.
So I provided a couple of resources here. So Georgia State University has a pretty nice FBA BIT program, training program. I would say for a large chunk of students, it's going to be appropriate. And it really just kind of helps school systems to create a streamlined and identified process for FBAs and BITs. And then, of course, I run a school consultation program. It's what we do. We do trainings, consultation, support, lots of services, and we just seem to keep on growing. So there's a link there where you can check out our webpage. And if you have any questions, please feel free to reach out to me. I also provided on the next slide, I provided some books that you guys can look at. These are ones that I think are teacher friendly and appropriate for the school setting. And it happened to be alphabetical order, but I think I actually put those in order of what I think is best is that Alberto and Troutman. Like if you're a teacher, if you're in a school setting, like that is a great resource for you. And then those other two resources are great as well.
This slide has our contact information on it, as well as the link to the Southeast MHTTC website. So if you have follow-up questions, you're welcome to email myself or Diva, as well as there are links to, and they're shown on kind of the previous slide as well, links to some of the resources on the Marcus Autism Center website if you're interested in follow-up school consultation. We are wrapping up the presentation, but I realize we do have a few more minutes left. If there are questions, please drop them in the chat box. We would be happy to stay on for an additional, 5 or so minutes to answer some of those questions.
Thanks so much, Catherine and Diva, for such a wonderful webinar. And on the next slide, you can see the link to the Southeast MHTTC website and the link to our listserv. So if you are going to go ahead and sign up for our listserv, you'll want to click the tab that says School Mental Health to get on our listserv. And then again, on social media, there's Twitter and Facebook. If you use those, we encourage you to sign up to follow us. And on the next slide, I just want to remind you that as part of receiving SAMHSA funding, we are required to submit data related to the quality of this event. And we ask that you please take a moment to complete a brief survey about today's session. And after you complete the survey, you'll be redirected to a second survey that includes additional information our center likes to collect to continue to improve the quality of our trainings and make sure we're addressing the needs of stakeholders in Region 4 through our programming. We greatly appreciate it if you take the opportunity to complete the second survey as well. Thank you so much. And it looks like we've got a few
Yep.
questions in the chat. Yeah.
Yeah, I was just taking a look at them. Let's see, I'm going to scroll up to make sure I am seeing all of them. Do you have any additional information for helping children with ASD that have abuse or a trauma history? So that's an important question. We know that obviously that students who have autism or and autistic children in general are at an increased risk to experience abuse. I don't have any like specific resources to drop in the chat box right now, but I'm happy to follow up. I would be thinking about partnering with your kind of mental health team and thinking about supporting that student.
I can tell you this is like an area of interest of mine. And there's just not a lot out there right now on like combining trauma-informed approaches with other theoretical orientations. So really at the end of the day, it's going to be finding a professional who's informed in both and is able to integrate both approaches. So like there are ways to like make tweaks to like a behavior analytic treatment package and make sure that we're also sensitive to that trauma history. Absolutely.
Yes, there is significant need for this. I want to say I came across a talk recently that was on how to support or at least kind of entering into the area of how to support. So I'll see if I can find that to pass along. I see a question around bribery being bribery is tough, right? So I appreciate the comment here, how to predict or kind of prevent the behavior in the first place.
Yeah, and I think you kind of hit it on the head, Christina, when you said $1 million question, right? It is, and it's hard, like when you don't know yet, and it's like, oh, what do I do in this moment? In the moment, I would try to like make a shift. I would stick to making sure that I'm not reinforcing the behavior, if at all possible. And then knowing for next time that like this is a trigger for this kid and how can I set it up differently next time. If you absolutely like you cannot get anywhere without reinforcing that problem behavior, we can also think about what's called differential reinforcement. And that just means that you're differing the level of reinforcement according to how desirable that response is, right? A lot of times we do this naturally, but we can also like set up contingencies like that. So maybe in that moment, you reinforce the behavior. Say, for example, you presented a task and the student was absolutely refusing to do it, right? So maybe in that moment, you'll just say, okay, like, you know what, I'm going to give you a minute to like chill out and then we're going to come back to it, right? So you provide like a small reinforcer, right? And that's not ideal, but sometimes it's what we got to do, especially in school settings, right? And then from there, when you come back around to it, maybe you present it differently. You set up a reinforcing contingency like, look, we need to get this worksheet done. When you're done with this worksheet, then you can have free time on the computer, right? Or, you know what, we need to get this worksheet done, but we don't have to do all of it. Let's just do the top half, okay? So do you want me to help you with it or do you want to do it by yourself? There's other ways that you can think about presenting it. And then once you gain compliance in that situation, you see that student engage in the alternative behavior, and there's a big reinforcer, right? So that is that difference. Like inappropriate behavior, maybe we have to reinforce it just with like the lowest level reinforcer we can possibly, put together. And then when we have that appropriate behavior, it's a party, right? You get that difference? Okay.
I see one last question that I feel like you can speak to really nicely, which is the FBAs that one of the metro school districts use are vague. How do I make them step up their game? Are there standards?
Send them to me. Paula, that, you know what? I take it back. That other question is not the $1 million question. This is the $1 million question. This is a problem everywhere. It's across the United States. There are studies on this. It is, at the end of the day, it's a systems level issue. And it's not like at a district level, it is at a national level. There is not enough guidance on what is required for an FBA, when an FBA even is required. How long, we have like these guidelines, like if a parent requests an assessment, you've got to complete that assessment within 60 days, right? If we're talking about like special ed services or something. Like there's all these other guidelines, except when it comes to behavior. So it's unfortunate. If I had a magic wand, that's definitely one of the things I would use it for, is to change that. But Paula, if you are interested, I do have a specific service line where I am training district level professionals to complete the full range of FBAs, meaning using some more empirically based and experimental methods. So meaning we're actually manipulating variables through that project. We're able to get FBAs done and bits introduced into the classroom within 3 days or 3 visits. So it's pretty effective, and it's based off of a model that I did in Iowa that was very successful as well. And so I'm figuring out how to apply it to Georgia. Do you want me to just go down these questions, Catherine?
Yeah, I actually need to hop off.
Yeah, you gotta go.
To attend them. Yeah, but
yeah, I'm happy to stay on for a few more minutes and answer questions. But I know Catherine, you want to?
Thank you so much. Thank you so much for all being here. I'm going to hop off, but thank you, Diva, for staying on to answer a couple more questions.
Of course. All right, so I'm going to just kind of go down the line and answer some of these questions. So Diane asked, what does research or your personal experience say about the use of iPads or electronics with autistic students in school? Getting them to give them up when transitioning has proven to be a challenge. So there's a lot of research on access to preferred items, the power of iPads, and how motivating they can be for students. And sometimes they're motivating appropriate behaviors, and sometimes they're motivating inappropriate behaviors, right? So I would say we have to be very intentional about our use of iPads, right? I think in any access to tangible item, any reinforcer, if we're using it in the school setting, it needs to be clear that like, this is not your iPad. This is the school's iPad. You can earn access to this. This is not yours, right? Because that's kind of what I see a lot, is like students are like, give me my iPad. Dude, it's not yours. Like, let's be clear on that real quick. And then I see like they get mad if like if another student touches it or uses it, or they think that they should just have it all day long and like free access. There is no free access, right? Free access is not available out there in the world, right? We don't just go to the Apple store and pick up an iPad and now it's ours, right? That's not real life. So it's not real life for them either. So we have to be just very intentional with how we use it. I think they can still earn it. We have to set boundaries around how long they have access to it. For some students, really brief access is not enough. For other students, if you give them access for too long, you're going to be more likely to see problem behavior when you remove it. It just depends, and each student is different. So that was probably a really long answer, but I think I got to the heart of it. Let's see, any other questions? Alyssa, I don't think I saw the question. I don't know which host you sent it to. Do you either want to like, oh, there it is. All right. I'm gonna read it out loud.
Long. I was wanting I work in a CSU. And so, when the kids come to us, it's usually because they've acted up, at home, but they
Yep.
have to stay here.
Mhm.
And, it's really hard because they're out of their structured environment.
Yep.
They don't have access to certain things that would normally cause them problems.
Yep.
But again, it's like, how can you really help them? Whereas what I do is mostly try to help the parents
Yep.
learn to manage their behavior. But
Yes.
is there anything I can do specifically, just to kind of help the child
Right.
in such a contained, crazy environment?
Yeah, it's really tough. I mean, you're at a crisis center. Students are children. Sorry, I'm in students mode because that's what I do. But like kids end up there because they're in crisis. And parents are at a loss, they don't know what to do. At the end of the day, a crisis center is not the same as a treatment center, right? So I think the biggest thing is getting them connected with resources to access ongoing treatment. I think beyond that, it's case by case, right? There's going to be some kids who have the cognitive capacity and you can talk to them about emotional regulation, maybe some mindfulness strategies. You can look at commitment therapy strategies. There's TBT, but I can't honestly say that I'm a fan of it. But I think, it's always case by case. Like the same approach isn't going to be the best approach for everyone, right? So I think you can, do the best you can with what you got, right? I say that all the time, especially in our program when we're working in schools. Another big thing I say is control what's controllable, take good data, and hope the rest doesn't do you in, right? Because you can't control everything. I saw, I think when we were talking about setting events earlier, somebody talked about like parents and like getting parents to like not do these things that are setting events for the school day. Can we control parent behavior though? Sure can't. You can't. So like all we can really do is we can talk to the parent and see if we can get their buy-in and get them to change their behavior. But if they don't, we almost have to plan for them not to, right? We have to have that plan of, all right, if this kid still comes in this state, right? Like we have to have a plan of how we're going to address it in this setting, in my classroom, because that is what I have control over. And that's really what we have to focus on. So I guess that's my like politician's answer to your question.
Okay, thank you.
You're welcome. All right, let me see. Any other questions? All right, that's all the questions I see. But if anybody has any others, you can drop them in there, or we can close it up for the day.